Okay, hello everyone at Achieve, and welcome back to our kind of podcast series and Facebook page if you are joining via the Facebook sessions. I'm joined today by a very, very special lady and someone who I think that you will find really, really interesting. We've had a lot of questions around kind of hormones and menopause and how it can affect weight management and lifestyle. So we're really, really lucky today to have the fantastic Dr. Katie Barber. She's been a GP for 15 years. Actually ran the NHS menopause clinic at the John Radcliffe in Oxford and moved into kind of community gynecology and is now working as a menopause specialist. And you've actually set up your own clinic now, which, as you said before, has gone from strength to strength. So first of all, thank you so much for joining us. And I can't actually tell you how valuable this is going to be to our clients, both male and female. So really, really appreciate you being here. To start us off, let's just go straight in with, first of all, your interest in women's health and why you think this conversation needs to happen around kind of menopause and things.
Thanks for that wonderful introduction, Lizzie. That's really kind of you. Yeah, no, I'm somebody who's always had a real interest in women's health because I think we are a unique breed as it is, and we have things that affect us differently to men. So, you know, we have a transition through our life, through our fertile life, and then into our menopause. And a lot of women are spending nearly half their lives now in menopause. So it's really important that symptoms that are intrusive of day-to-day function and affect women's health are properly managed, addressed. I think the one thing that's really highlighting how important menopause is a lot of the media that's been going on, in particularly the last week or so. People have watched various programs and podcasts and stuff going through on Instagram and Facebook about celebrities really trying to highlight the menopause and not being afraid to talk about it. You know, we are as women forming a large proportion of the workforce. Menopause affects everybody in such different ways. No two women's experience of the menopause is identical. So it's really important that we listen as healthcare professionals what is affecting women and help them manage those symptoms so that they can achieve as much normal functioning life as they possibly can and really continue to thrive for many, many years after the menopause.
Yeah, amazing. And I think you're so right that actually it's not really a conversation that we are having as much. I myself have never, ever had this conversation before, which is crazy. I'm going to be 30 this year. I've never learned about it at school. Not really a conversation I have with friends. Not something that my nan spoke about or my mum spoke about. It just really isn't something that it almost feels like something that we're very ashamed of, which is crazy because, like you say, like every female will go through this in their lifetime. So why are we not kind of prepared for it? I always say to my clients, like, forewarned is forearmed. So if you kind of know things that are going to happen, you can prepare for them. And even if you have prepared for something and say it doesn't go as well as you want it to, at least like mentally you can kind of be like, okay, well, I knew this was going to happen, so I just have to breathe and kind of embrace it type thing. So kind of, you know, around that, is there anything that we can prepare ourselves for, say, pre-menopause? So for those of us who haven't experienced that yet, what can we be doing to educate ourselves and also just prepare our own bodies and minds?
Yeah, great question. I mean, a lot of this stems back to education. I mean, a lot of the media recently has been about educating doctors and educating healthcare professionals and making sure that this is on the curriculum, not just in medical schools, but in schools. You know, a lot of children now are having PHSE lessons, which include puberty and issues about gender, these other really important issues. But menopause should also be on there. You know, young children need to understand that, you know, if mummy's having a hot flush, mummy's cognitive not working quite like she normally is, this is probably because she's with menopause symptoms, and it's being aware of that really. Just as a personal anecdote, I remember being about 13 or 14, and my mum, who sadly had breast cancer in her late 40s, was getting ready for work, and she worked for a GP as a manager, and she'd got her dress on, looking lovely for work, and then 30 seconds she was back in the shower, and I remember thinking, what's going on? You just had a shower. You're dressed. You've just dressed. What's happening? I kind of got a little bit of a feel for what was going on, and this was the 90s, where really you didn't talk about menopause. You just had to get on with it. You didn't go to your GP for help, or if you did, you were given HRT, which if you had breast cancer was just a no-no. And I mean, things have changed going forward from there. But a lot about menopause is really making sure you have a good, healthy lifestyle, and you can address as many risk factors for breast cancer as well as menopause all in one go. So when I talk to women in menopause consultation, I don't just talk to them about HRT. It's about what risks have you got for not managing your menopause well and not giving yourself the best chance to remain healthy in later life. And those include things like not smoking, minimizing alcohol, maintaining a healthy body mass index, so under 25, making sure that you really do lots of weight-bearing exercise, which not only is good for endorphins and mood, but also really, really helps manage those risks for osteoporosis, so the bone density loss that's associated with estrogen at menopause. That's also linked with alcohol and smoking. So everything you can do to really overhaul your lifestyle in the run up to menopause and continuing that is going to do you really, really well on the health side of things going forward.
Yeah, I mean, obviously we are a weight loss, weight management service, and something that I really try to get across to our clients is actually, I know you mentioned kind of BMI there and things, and I think that so much, this is kind of going off on a little bit of a tangent, but I will bring it back around, I promise. So much of kind of weight and stigma and, you know, people being overweight and obese and all of these things, actually we kind of get scared into losing weight, and we think about it in terms of aesthetically how we look and that number on the scale. And I'm really, really trying to get people to think more about, you know, actually, if you're fueling your body correctly, if you're putting the right nutrients into your body, and like you say, doing weight bearing exercise and strengthening your bones and your muscles and improving your posture and making sure you're not sitting down too much and all of those things, then actually you're going to improve in so many other areas of your life that aren't just related to that number on the scale or your BMI and things like that. So I just, I really appreciate you kind of bringing that to light, and actually how you know, reducing alcohol and stopping smoking and actually improving the nutrients that you're fueling your body with are so much more important than maybe just that number on the scale or how we look or the size of the clothes that we're wearing and things like that. So I think that's really, really important, and I'm kind of glad that you brought that up. What you sort of touched on a few things there in terms of improving lifestyle. Is there anything, and I think it's important that if somebody's listening to this or watching this and they know that their lifestyle is not in, you know, tip-top condition, that it's important to kind of start slowly and gradually build up new habits so that then they are, you know, sustainable forever. So do you think that there's anything kind of maybe the most important thing to focus on when you're first starting to kind of overhaul your lifestyle to kind of improve, well, your overall well-being?
Oh, completely. I mean, I think, you know, it's all about realistic expectations, isn't it? I mean, if you decide on Monday that you want to change your weight and stop smoking and alcohol, you're probably going to fail on all three counts, because you've got to set realistic expectations about what you do. So little steps, and every little step you make, every unit of alcohol less that you maybe reduce by, every pack of cigarettes less that you smoke, every pound or whatever you lose, and the more exercise you do, they're all going to be beneficial. So I think a lot of women find it very difficult, particularly at the menopause, because it is harder to lose weight. Our metabolism changes, we gain weight around our middle, which is not a great place to gain it, really, because that's where we're associating with higher risk of heart disease and these other things that come down our way. So actually, you can really focus on, I'm going to do little steps, and those cumulative little steps will have massive improvements for your health and lifestyle. I think you can't really say there's one thing to try and focus on. A lot of women in my clinic will be very much, it'll be the alcohol or the weight, or it'll be the smoking. There's very few women where I'm really trying to struggle to manage all. That doesn't say that they don't exist, but for a lot of women, let's just focus on one thing. What is the thing that you find most difficult? What can we do to help support you. We're really fortunate in Oxfordshire. We've got such a fantastic service such as Achieve to really help women with the lifestyle overhauling, because I know you're not focusing just on weight. It's about the whole person and what are they finding difficult. A lot of our lives and the way we function, there's usually a trigger. There's something in our lives that's going on that make us maybe indulge in alcohol too much, maybe make us smoke, maybe there's stress going on behind the scenes, maybe there's mental health issues. These are really apparent at menopause. And menopausal women inevitably hit menopause around the time that children are starting to grow up and hit puberty or flee the nest. There might be changes in relationships, in work settings. If you're not fulfilling your potential at work because you're having hot flushes every 10 minutes, that then is something you get stressed and anxious about. So it's really a multifactorial approach to saying, what symptoms are you having? What issues are you struggling with? Who can help you support those and help progress through and make some improvements? But little by little, don't try and overhaul everything in one go, because it's realistic. You're likely to fail and you'll feel really bad for yourself that you set these targets that you can't achieve.
Yeah. And then you sort of end up in a bit of a cycle of, I failed, and you blame yourself. And actually it's, absolutely. And we definitely do touch on that as well. And I love that it's something that you encourage at your clinic also. And it's not just a case of, all right, here's some drugs and this is going to fix you and stuff, but actually it's an overall approach. So that's amazing. I just wanted to ask you more around the menopause. So really kind of, I watched the Davina McCall program the other day, and I found it really, because like I said, I've never spoken about menopause before. It's something that came up in a team meeting for us, something that comes up with a lot of my clients, and I was like, oh my goodness, I don't know how to help you, because I honestly have never had this conversation. So I watched the program the other night, and I thought, I didn't realise there was so much around it that I thought it was just hot sweats and, everything stops working and you can't have babies anymore. That, like, honestly, and I hate to say that, but that is kind of my knowledge around it. So I would really love to kind of touch more on specifically the mental health aspects, because that really, really shocked me. The brain fog and things around that, because again, like, if you've worked so hard all your life and then you get to a point where you're really excelling in your career and you can't put two and two together in your brain because something's going on there, I think that's quite scary, really. So I'd love to touch on that, the mental health, the brain fog, and then maybe some of the physiological effects and symptoms that some might get either kind of pre-menopause or when they're going through it as well.
Oh gosh, I mean, you open a can of worms. I think to women, any symptom you've got that you think isn't quite your normal self is probably menopausal. I mean, it's menopause just affects women in so many ways. Estrogen is a key hormone for most cell processes. So the hot flushes and the sweats, interestingly, very few women come to my clinic and that is their main concern. The main concern for women is often, I can't function, I'm sad, I'm angry, I shout at my husband, I shout at my children, I've wanted to hurt myself, I wanted to end my life, I've wanted to hurt somebody else. My joints hurt, I'm getting migraines, I can't concentrate, I'm losing the ability to find the right words in conversation, I can't stand up in a meeting anymore because I just freeze and I don't know what I'm talking about. It might be that they're finding just have no energy, awful fatigue. One lady said to me a few weeks ago, I used to run 5K 3 times a week. She said, I get back to work, I have no ability to do that. I'm so exhausted. And it's that unbelievable fatigue that hits women, that they just have no energy, no ability to enjoy life. And that is so sad when you've got many, many years ahead of you. For some women, this starts well before 50. And we quote the average age of menopause in the UK is 51 to 52, but majority of women start with some perimenopausal symptoms 40 plus. If having menopause under the age of 40, we call that ovarian insufficiency. That's a little bit earlier than we would expect. About small proportion of the population, 0.1%, will have a premature ovarian insufficiency and a very, very early menopause. But I'm seeing more and more women coming out of the woodwork, sort of 40 to 45, saying, I'm still having regular periods, but these are the symptoms I'm feeling. Can I have some help, please? So the ability to function cognitive is a huge issue for more women, I would say, than the flushes and sweats sometimes. But also much more than that, it's the effect on your skin, dry hair, crumbly nails, osteoporosis, dry vagina, painful intercourse, loss of libido, loss of confidence, loss of self-esteem, loss of being is what some women will say is, I am just not me. Something's happened to me over the last year, 2 years or whatever, and I'm just not myself. And that has a massive effect. And as I said at the beginning, it's not just effect on the woman themselves, it's how it impacts on their family and their work, their ability to hold down relationships and function normally. So any symptom a woman has could be menopausal, put it that way.
Wow, yeah, there's a massive kind of scope there, isn't there? And so much that you could be experiencing. Around the kind of the cognitive function, and again, sort of with the sort of brain fog and things like that, how would you, what's the best kind of recommendation for someone to cope with that?
There's lots. I mean, there isn't a single thing really. And this is where the British Menopause Society have a lovely statement that they say menopause care should be holistic and individualised to women, because his ex that comes to see me, who's actually really bothered by her flushes and sweat, the treatment options for her are going to be different to Mrs. Y, who comes in and says, actually flushes and sweats, they're fine, I'm not struggling with those, but please let me just function mentally, I'm really struggling. There's lots of different options available for women, and the one thing I always say is it's not HRT for everybody. HRT isn't the best treatment for everybody. For a large proportion of women it's significantly beneficial, but actually if you're struggling with your cognitive function, mental health, there's lots of different things that can help. So and you go back to lifestyle. What is it in their lifestyle? What's going on socially that's difficult? Do you need to think about psychological support for this lady? Is it a case of actually there's some reactive life events going on? You know, if we just had a job transition or a child going off to university that needs time to cope with and adapt. Can they have HRT? Is HRT going to be useful for them? Because it does actually help with a lot of non-sweat flush symptoms. Even though women think that that's the main reason to take HRT, it has so many other benefits for women. The other thing to remember is behind the scenes, HRT provides a benefit for your cardiovascular system, reduces the risk of type 2 diabetes, reduces the risk of osteoporosis. So a lot of women who are quite apprehensive about taking HRT, when they hear about those other benefits that they're going to achieve from taking a hormone therapy, will really actually start to consider why it could be useful for them. But I think it's again multifactorial. You've got to look at what's the problem, what's behind it. Do they need some psychological therapy support? Are we talking about giving hormone therapy? Is there an alternative therapy for this woman? It's very sad to hear that a lot of women across the country are being prescribed antidepressants when actually hormone therapy would be much more effective at controlling their symptoms. But that's not to say every woman doesn't need antidepressants. You know, there are some women who, even with hormone therapy, the psychological aspects of menopause are still having an adverse effect on them, and they can consider using antidepressants alongside. But it has to be for the right reasons. You have to really explain what's going on before you just hand out antidepressants. Certainly for women with breast cancer, antidepressants are actually first-line treatment for women to manage flushes and sweats, so they have a benefit on flushes and sweats. Had a patient a few months ago came to see me, and she's had breast cancer, so decided HRT was really not a good idea. It was going to increase the risk of recurrence. Has antidepressants purely for flush and sweat control. Fantastic improvement for her, but she mentally didn't have any issues. It was purely flushes and sweat, and that's where it's a very, unique experience that each woman's going to. You have to really listen to what's going on before you prescribe or recommend a treatment.
I mean, that's really interesting. I didn't know that about antidepressants at all, that it can help with that. I think that it's very difficult because some people, and it's the same with mental health kind of issues and things, is that sometimes people just feel so low and they're really struggling and they just want that quick fix. And we're in a society that moves so quickly all of the time, and we're like, no, just give me a pill, there's a pill for that, give me a pill, give me this, da, 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 whatever. But actually, like you say, just being really patient with yourself and just looking first of all at your symptoms, at everything that's going on. Like you say, maybe there's stresses coming from other places, and like, are you looking after yourself first of all, and then finding those areas where maybe you need to do a bit of work on your growth, or on you, or on maybe your lifestyle and that kind of thing, and then being able to say, I've tried all of these things. And I think it's great for people. I don't know if you would encourage this, but kind of keeping some kind of like a symptom diary, and maybe looking at some triggers and things like that, of where certain kind of symptoms might be heightened or occur, so that then they can go to their GP and say, this is what's happening and this is what I've done, and all of those things. And it's a shame that we have to do that, but GPs are mega kind of overloaded, and actually it might be easy for them to just go, well, not easy, but it might just be a quick answer for them, here's antidepressants, here's this. But if you can maybe prove, I've done X, Y, and Z, I might need help with a referral in some other area, that kind of thing. Do you feel that might be something that would be beneficial to women who might think that they're going through the menopause or maybe perimenopausal?
Absolutely. I mean, if you think these GP appointments, even if they're remote as they have been over the last 12 months, are 10-minute consultations. I give my menopause patients 45 minutes to an hour per consultation. Amazing. Because there's so much that you have to explore. I mean, I inevitably run late in general practice when I'm a menopause consultation because you can't do it in 10 minutes. But there's some fantastic technological resources there at the moment. Louise Newson is a menopause specialist like me up in Stratford-upon-Avon, who's really taken the world by storm with menopause service and education and teaching about the menopause. There's something called the Balance app, which is really quite helpful for women to log symptoms. And it allows you to sort of really look at the things that are bothering you and track what's going on. And particularly for women who may be perimenopausal, where they're still having periods, it's that kind of, how am I now? And what part of my cycle, my symptoms rear their ugly head? For example, I mean, I could talk forever on this, Lizzie, but the classic is migraines. And a lot of women get really quite frightened about the use of hormone therapy when they've had migraines, because migraine with aura, particularly flashing lights, visual disturbance, light sensitivity, is a contraindication to using oral estrogen in the bind pill in younger women. And everyone thinks that therefore they can't have HRT, but providing you use HRT through skin, that doesn't increase the risk at all. So a lot of women will find their migraines worsen at the menopause. That's because estrogen is being withdrawn and you end up in estrogen deficiency. And for those women, if you give HRT, sometimes the migraines improve and the frequency improves. So those kind of things, presenting to your GP and saying, look, my migraines are worse, but they're getting worse when I'm about to have a period. And once I get my period, they seem to ease off for a couple of weeks. Or actually, my mood symptoms are really an issue, and I'm finding these are particularly pronounced during a certain time of the month. All this information is really helpful. We're using a lot of e-consult software now, so women can send in information on an email, and then the GP will digest the email and sometimes provide advice without needing to speak or see them, or we will phone or speak to patients. And actually that's been really helpful because it allows women to really tell the story in an email. And if I get an e-consult on menopause, I'll grab that and go, oh, look, this lady really struggled. She's put on here, she's got symptoms, particularly premenstrually. Her periods are becoming a bit erratic. She's feeling down, she's feeling low. Let me ring her and see if we can get some help in there. So yeah, technology is really quite useful. I'm working with a gynecologist to try and facilitate access to an app that allows direct input with psychology and really hones in on symptoms women are getting. So psychologically, you're really struggling. Psychology help will be the mainstay of treatment. If you're struggling with obviously weight, healthy lifestyle, then dietitian, nutritionist, exercise therapy alongside, or actually if you really need medical help for your symptoms like hot flushes, sweats, brain fog, etc., then it links in with the clinical side. And And that's what's really important to remember with menopause, is this isn't just hot flushes and sweats, and it can really focus on all those different things. If you can get that information down, because if you go to a 10-minute consultation with a GP and you're menopausal, chances are you'll probably bring up about 1% of the symptoms you're actually struggling with, because there isn't much time, and your brain might not be functioning at that particular moment to really give your GP a succinct rundown of what you're struggling with. So I find it really interesting when I see women in my menopause clinic that the start of the conversation, if someone's really struggling, it's almost like teasing information out piecemeal, and I tend to let women talk, and then I'll focus on and say, go back to what you were just saying, tell me a little bit more about that. You can see, even overtly in some women, cognitively, they are struggling to verbalize what they're struggling with. So you get a little bit of a feel just by talking to them and say, you're really struggling to tell me what's going on. How's that affecting you on a day-to-day basis? Can you work? Can you function? How's managing the household? Is that doable, or you find things difficult? So anything that they can write down. I love it in the menopause clinic when women come in with a list of symptoms, because they've clearly thought about it and they've said, right, these are the things I want to discuss, because invariably they won't remember it in that consultation. And it's really important that there's lots of information sharing. There's some fantastic resources out there. The Women's Health Concern is particularly good for menopausal women. It's written by doctors, specialists like me, for patients, and there's lots of information on there, so they can extract the relevant bits and take it to their GP.
Amazing. What was that again? Sorry?
The Women's Health Concern. So remember the whc.org.uk or something like that. Women's Health Concern. It's basically the patient bit of the British Menopause Society. So they have a really useful fact sheet section which documents every aspect of menopause and HRT, and there's some lovely data on there about the breast cancer risk for women who are particularly concerned. There's a really useful complementary therapies fact sheet that I often share with GPs and women who maybe not have HRT because they've had breast or ovarian cancer. But there's topics on there. So if you're really struggling with vaginal dryness, there's a fact sheet that covers that and things that you can do to help that. There's a thing on about cardiovascular risk. There's a lot of information about lifestyle changes. For young women under 40, there's a fantastic website called the Daisy Network. And the Daisy Network is specifically for really young women under 40 going through an early menopause, either because it happens spontaneously or maybe they had cancer or treatment for endometriosis that's rendered menopausal. And both those sites have a user forum so people can get information. I also produce a monthly fact sheet from my own website, and there's an ability to sign up to my newsletter on my website for women, and I tend to focus on a different topic each month. So this month it was all about breast cancer, but we've covered estrogen, progesterone, testosterone, and I'm sure things like early menopause, etc., will be further down the line.
Yeah, and I'll link all of those in the when we put this out, and in the show notes for on Spotify and things. So I'll make sure that we've got all of those links correct before I put it out there. Amazing. I really do. There's so much to discuss. It's really hard, isn't it? I really want to touch on kind of the breast cancer link and things like that. But first, can we just go back to kind of talking about lifestyle and things? Obviously, a lot of our clients are looking at losing weight. We've had quite a few entry interviews recently where people are coming onto the course and they disclose that they are on HRT, or they are perimenopausal, or they're going through the menopause. Obviously, for us, we get people to weigh themselves each week to see if they've lost weight as part of the course. With that, how much? I mean, I don't want to say that it's pointless to try and lose weight when you're going through the menopause, but I just really am trying to encourage women especially to be a little bit kinder to themselves when they're going through something like this, and actually the benefits that they're going to get from the course, just from providing their body with more nutrients and moving more, should kind of outweigh maybe that number. And I didn't know if there was some kind of more science behind that and why it's so much more difficult to lose weight on the scale when you're going through that, or you are on HRT or perimenopausal, etc.
Good question. So there's not a vast amount of data out there, but there is some studies that show that actually that HRT itself does not cause weight gain. So by taking HRT, you're not going to gain pounds. There's a couple of hormonal therapies we use as contraceptives which are associated with weight gain, independent of what the woman does, exercise and eating. And But HRT doesn't have that impact in that way. I mean, you will spend a long time, I'm sure, identifying what the triggers are for women in their lifestyle changes that they want to make, or how they look at the relationship they have with food and exercise, all these other things. It's harder to lose weight at the menopause. That's because estrogen is a hormone linked with metabolism. So, you know, your ability to lose weight and find it easier to see the impact of your change in lifestyle on your weight is going to be slower at menopause than it was before. It's always worth thinking about other hormonal causes as well, because a lot of women have other things going on health-wise that can impact on their weight and their ability to lose weight, particularly if they've got mobility issues. If you're finding joints are painful and it's hard to exercise, or exercise has fallen off, that then also has an adverse effect. If we take the same calories in, but we don't burn off as many because we're not exercising as much, that's just going to gradually increase our weight. So there's lots of different reasons, but yes, most certainly menopause itself and weight gain linked hand in hand. So women menopausal will often find it much harder to lose weight and often find it's much easier to gain weight, but HRT does not affect that. So a lot of women in fact find that when their menopausal symptoms are really, really well monitored and treated, that actually they've got more motivation to exercise. They can be more focused on, I'm going to really look at my lifestyle and my diet and my exercise, my alcohol, my smoking. I'm going to make some changes here because actually I'm now sleeping because my flushes are controlled. I've now got more energy to exercise. I feel I can really take the world by storm and really grasp what I need to do with my lifestyle and overhaul it. So you do get into a bit of a vicious circle at menopause, and it's not just one thing. It's not just loss of estrogen. It's lots of other things as well.
Okay, and how long? Sorry if this is a silly question, but how long is it different for everyone? But how long does menopause last?
That's the thing where we don't have a crystal ball. So you're post-menopausal for the rest of your life. So once your periods are completely stopped and your ovaries are no longer producing eggs, you are in post-menopause. So that goes on forever. Symptoms and the issues we have are variable. There's no, I can't predict. There's no test that tells you where you are. There's no test that tells you when symptoms are going to stop. For some women, they have symptoms right through until the day they die. For some women, very lucky few, but very few, it's a case of, oh, my periods have stopped. Oh, I had an odd hot flush. Oh, I'm fine, off I go. But they are not the majority in any way. They are very much the minority. And the duration of symptoms and how adverse they affect someone is so different from woman to woman, and it's not predictable. So the general feeling is that a lot of women will get several years of symptoms starting before their period stopped and carrying on beyond that time. But, you know, I have to say that the number of women I'm meeting these days is actually much, much more prolonged menopause, starting many, many years before period changes and often progressing well beyond the age of 60.
Okay, yeah, I thought that would probably be the case. But I just wanted to know, is there kind of, you know, a beginning and an end? Like, do you ever see an end to it, or maybe not?
Sometimes, but that's where actually, if we look at women and find out what's affecting them and manage those symptoms, then it's not an issue, because we're treating those symptoms and we're giving them the hormones that they are no longer producing in abundance, but they need to function. And I think that's how you should think about it, that, you know, this is a process that happens sometime between 40 and 60, let's say, majority 45 to 55. But withdrawal of hormone and loss of a hormone that we've had in abundance before then, and how it affects us is individual and different.
Yeah, okay. Thank you for that. So going back to kind of, you talked a little bit about breast cancer and the link, and from what I understand I mean, I don't actually remember these headlines around it, but watching the program on Channel 4 the other day, and they said about how there's a really, you know, they did this big study, and there's a massive link between HRT and breast cancer, and actually then 50% of women came off of HRT due to this study. Could you just tell me a little bit more about that, and just kind of shed a little bit of light on it for me?
So it's a shame that that's still very much in the forefront of a lot of people's mind, and also a lot of healthcare professionals' minds. Actually, you know, if we go back 25 years, maybe longer, 30 years, HRT is very popular. and women would see their GP and it would be an automatic prescription. But we were using a lot of something called conjugated equine estrogen in those days, which is the pregnant horses extract, so an equine estrogen. And that was that was combined with a lot of synthetic progestogen. So if you've got a uterus, you have to have both estrogen and progestogen, because if you give estrogen alone to a woman with a uterus, it could cause some abnormalities in the womb lining. And the majority of women haven't had a hysterectomy, so you have to give hormones. And it's a combination of the estrogen and the type of progestogen that increases the breast cancer risk. So the types of estrogen being used in that study are very, very rarely used now. We have some phenomenal products on the market, and I can probably count the fingers of one hand how much conjugated equine estrogen I've prescribed in the last 5 years. And most of the time it's directed because the patient has requested it specifically, not because I'm choosing that that's the best therapy for the woman. So we don't use a lot of those products anymore. But yeah, the data that came out was quite frightening. So the WHI did a massive study, which culminated in some results just going into the noughties. And actually that was much more realistic about breast cancer risk. And that was where in Davina's program last week, you saw the pink balls dropping from the ceiling. Baseline risk of 23 cases per 1,000 women using no HRT, and 4 extra cases on top, so 27 rather than 23 for women using combined HRT for 5 years. And she also really nicely on that program showed the pink balls dropping for risks associated with obesity, 24 extra cases, and smoking and alcohol and things like that. So I think the other thing to say, Lizzie, is there's a lot of differing data as well. There was another study, the results of which were published in the Lancet 2 years ago now. And that quoted the risks slightly differently, which I'll just run through, because actually these are the risks I tend to people, because it's the most recent study, and it's really sort of a consensus from various menopause societies across the world. And they sort of use a risk that you're looking at 1,000 women after the age of 50, and you're following them for 5 years, and it's their risk of getting breast cancer between 50 and 69. And actually, if you look at the women on continuous HRT, combined HRT, so these are women who may be a bit further through menopause, it's 1 extra case per 50 women with 5 years use of HRT. So going up from 3 in 50 to 4 in 50. And for women on estrogen only HRT, the risk is tiny. So these are women who've had hysterectomies. It goes up from 13 in 200 to 14 in 200. So 1 extra case per 200 women in that 5 years. So it's really quite low risks. When you look at things like obesity, which is a far greater risk factor for breast cancer, in fact, all cancers, than HRT, alcohol excess, smoking, these all really significantly increase our risk of breast cancer, and some of them far more than just taking HRT. And that's what, when I have a conversation with a woman, I really sort of impress on them that this is a teeny weeny risk when you look at lots of lifestyle factors. Going back to the beginning and saying lifestyle is key here. You know, if you want to modify your risk, lifestyle is the way forward. Your HRT adds a tiny risk, but not a huge risk. And actually, if that then allows you to function normally, to be motivated, to make those lifestyle changes, overall, that's going to be a huge benefit for you. So yeah, I think women need to be given the right information, and it needs to be presented in a way they can understand. And that pictogram that with Davina in the ball pit, I think will be remembered for a long, long time.
Yeah, I think, definitely having simple information that people can absorb is really important. And like I said, I will include all of these kind of links that you've mentioned today so that people can do their own research, because I think that's really important. And I just kind of want to impress as well that there are, unfortunately, you know, manufacturers will probably jump on this whole menopause thing, and they'll probably start trying to make money off of something, and they'll give you, I don't know, there'll be some kind of thing you can stick on your arm that's going to make you feel better, that's not from a GP or anything like that. They probably will make it, because that's what they do with kind of weight management and weight loss and things. But actually, I just kind of want to just to kind of impress on people that it's important to get your information from reliable sources, from people that have been in that industry for a long period of time. And yes, it's great that Davina is doing this program and she is talking to a lot of specialists, but also like going away and speaking to, you know, like someone like yourself, or going onto your website, or going and looking at people who've spent a lot of time, because I think it's important that people understand with GPs they have a lot to learn, and they're not specialists within menopause or within women's health, but there are people like yourself who are specialists within that, so it's important that they're seeking out the right information. I really love that the lifestyle thing is very prevalent here, and that actually if you are looking after yourself, not in terms of an aesthetic, like I look great, but from the inside out, then it's going to help with so many things kind of down the line as well. And I just think that's so important. And sometimes we do want a pill, or we want medication, or whatever it is, but actually that's just covering up a lot of things that we haven't dealt with. And sometimes people, and I don't mean this in a disrespectful way at all, but sometimes people just get a little bit kind of complacent and think, actually it's not me, it's the world needs to help me, the doctor needs to help me. But actually, if you strip it back and look at, are you moving your body? Are you having the right nutrients? Are you looking after your mind? Are you being kind to yourself? All of these things can really add up, and actually, hopefully lessen those symptoms and help you be in a better place for when you do get to that point. So I went off on a little bit of a rant there.
Actually, it's really funny you say that. I've got a very good friend who I won't mind saying this, because I've sort of heard her on her menopause journey and HRT, and she's perfectly controlled at the moment. She's a thriving mum, a thriving wife, a thriving professional, and an altogether delightful lady. And she said to me at the weekend, she said, "Do you know, Katie," she said, "I feel I'm happy with me again." And that really sums up how women should feel and how they should be properly managed. She runs, she's got a healthy lifestyle, she has some glasses of wine, she doesn't drink excessively, she enjoys socializing, and she would be quite open at saying, maybe I had 1 or 2 cocktails too many last week, but then I won't drink over the rest of the week, and that was my birthday, so I'm allowed to. But actually, it's lovely to hear the feeling of, I feel like me again. And I think that's what a lot of women who come to me say is, get me back. I'm not me. I'm not the person I know I am. And I don't want to become that person again, because I'm really struggling with every element of my life. So it's like you say, it's not just a prescription for HRT, it's so much more.
Yeah, and I think, like, sorry, because I know that we have to finish up, but I think that part of being a female is looking after a lot of people, and we take on a lot of other people's problems, and not even if you don't have children, but your partners and things like that. And we do really give a lot of ourselves to everyone else, and we worry so much. And I know this is stereotyping a little bit, but I definitely have noticed it a lot more. And with the female clients that I work with, is that we always put ourselves on the back burner, and we don't fill up our own cup enough. And then it gets to something like this, and we're experiencing, and our bodies are going like, oh my goodness, I can't think, I'm sweating, I've got this, I've got that, and we just push it to one side, push it to one side, push it to one side, until it gets to a point where your body's like, no, I'm gonna listen, like, you need to listen to me, because this is not right. And we really struggle to then go and seek out help, or look after ourselves, or and it's just I really think that that's something as well that women especially need to start just kind of, okay, and this is time for me. I'm looking after myself, and I'm making time to exercise and prepare my food, and like have less stress in my life, so that I can be a better wife, partner, mother, whatever it is. And yeah, I just think that's it's so important, isn't it? I'm going to finish up by just asking, what can because I think it's really important as well for men and everyone to listen to this and to get to grips with what menopause is and educate themselves. So what can we, as friends, as partners, as sons, daughters, siblings, whatever it is, what can we do to help support women that are going through the menopause?
Oh, so much. I was on Radio Oxford last year talking about this, and the fact that menopause isn't just about women. It has a massive impact on everybody in our lives. Support, listening, time, understanding, encouragement, go onto those online resources, get information, talk to your partner, wife, girlfriend, whoever it is, mum, and say, look, you're not the person that you were before. I'm really finding things are difficult for you. What's going on? Should we have a chat about it? Because a lot of women will come to their first menopause appointment to see me with their partner. And that's great, because they're clearly concerned about the loved one, and they want them to get the right advice and right help. And actually, it's really nice to hear a partner's views on how their loved one is going through menopause and how it's affecting them. And the really even more useful thing is when they come back with their partner, and I'll say to the lady, how are you feeling? Are you feeling any better? What's improved? What's still going on that's concerning you? And you often see the other half sort of nodding and saying, oh yeah, this is so much better. They're enjoying life. We went out for dinner, had a lovely time. We could chat again. Whereas before it was that kind of, I felt my partner was really inside themselves. They weren't flourishing, weren't fulfilling their potential. So I think it's really just that listening ear. And some partners are fantastic about going and getting the information themselves. They're recognizing what's going on in their wife, girlfriend, partner, and they're the ones that are actually saying, look, please get some help about this. I want to come with you. I want to support you through this. And I think that's the difficulty for some women, is that they feel they can't talk to their partner. And that's where I hear the sad cases about relationships ending around the menopause, because their partners haven't understood what's going on. There's been communication about the difficulties, and instead of trying to work through and get the right support and help, it's had catastrophic effects on their personal life. But no, actually, it's really, really important. I mean, my husband is non-medical, and I think he knows an awful lot about the menopause, having lived with me for the last few years, and hearing me on podcasts and things. He said, well, I'm great. I'm going to know exactly what to tell you. It's fantastic. So if anything changes with you, Katie, I'll be on it. But even he will share that with people at work. He might be having a male employee at work who he meets with and has a chat about. Says, oh, is your wife a menopause specialist? What do I need to watch for in my wife? And my husband will say, well, look at this website. It's really good. There's lots of information. My wife's got a website, stuff on there you can have a look at. So it's great. We've just got to share the knowledge and share the learning, and then we're all going to have a much better chance of living life to the full and everything being okay. But I think, for men particularly, it's about listening and being supportive, and not feeling afraid to mention it, because if you are struggling as a woman, if your husband says to you, I think you're menopausal and you're not coping with life, go and get some help, that's not the most constructive way to. But if it's a case of, look, I'm worried about you, I've seen this podcast, I've seen this article, I watched this TV program, should we watch it together? Should we have a read of it together? Do you want me to come to an appointment with you? Can we try and make a way through this? Those kind of things. Or I've noticed you're drinking a bit more, or we're not doing as much outdoor exercise. Should we try and improve that together? Let's try and do something. And that support is invaluable.
Yeah, I like, for my partner is lovely. It doesn't sound as great as your husband sending out all those podcasts. That's so sweet of him. But yeah, my other half, he really wants to fix things for me. So if he sees me feeling a bit down or a bit low, it actually, and we've had to have a lot of conversations around this, because I'm like, sometimes you can't fix it, but I just need you there to listen to me. So just like listen to me moan about the same thing, and then like let me work it out for myself, but just kind of ask the right questions. And there's a great video called It's Not About the Nail on YouTube. I don't know if you've seen it. Everyone, men everywhere, everyone just go and watch it, because it's so true. It's not about maybe the thing that I'm talking about, but getting it out and that kind of thing, and letting us work it out for ourselves, and just being there as a support is like you say, invaluable. And that goes for like I say, partners, daughters, sons, wives, well, not wives, but whatever it is. It's just
absolutely. Male or female partners, they notice a difference in their loved one going through the menopause. And I think for some women out there, they often have a female partner of around the same age that's going through exactly the same thing. So you can have that discussion and say, look, this affects me. Is it affecting you? Am I the only one that's going through this? And you know, when we've had consultations with women who've brought their female partner with them, it's really interesting when you see some of them are already on treatment and they're like, you know, I'm bringing my partner here because I saw myself going through the menopause a few years ago, and actually I'm recognizing these issues in my loved one now, and I'm really keen she gets the support I had. So it's that recognition and that understanding that you've just got to listen to what's going on. I think for some, particularly men in particular, libido is a huge problem in women at menopause. There's this massive discrepancy. About 50% of our estrogen comes from our ovaries. So when our ovaries stop working, our libido plummets, and testosterone levels too. And I think that, you know, that's an important part of a relationship. And for men, it's often a sign, well, okay, so do you not love me anymore? Is there something going on? And that's where a lot of relationship issues start. But if you can really talk it through and you've got a supportive partner that listens and engages and say, you know, it isn't just my libido, it's also the fact that I'm sore, I'm dry, I'm uncomfortable, it's painful, I'm not enjoying it. You think all of those different things and you have a really interesting chat with women about what is it affecting you and really hone in on those issues, then you can make it better.
Yeah, and I love that you brought up like a female relationship, because like you say, they could be going through that together, and that can be quite a lot in one sort, under one roof and one household. So getting that support at the same time is amazing. Or like you say, if one's been through it and one hasn't, that kind of thing is really interesting. Yeah. I really appreciate your time, and I know our clients will really appreciate your time as well. And like I said, if anyone needs any extra information, they can go to your website, sign up to your newsletter. I'll put the other links for the other associations that you mentioned and websites and things. If you did have anything else that you wanted to kind of add, feel free to pop me an email and I can put that out to all of our clients. But honestly, I could talk to you for hours. I've got like 100 questions. Honestly, it's just so interesting, and I feel so privileged that I'm kind of alive at a time when we can talk about these things, you know, and I'm in a culture that can, because there's a lot of cultures that can't talk about this. So I just really feel very privileged, and it's been so great to chat with you. And yeah, thank you so much. Hope you have a wonderful rest of your day. And yeah, thanks, Katie.
Thanks, Lizzie.